Hello, my dear Bangladeshi brothers and sisters. This is Dr. Geeta Haripriya, Chairman, Prashanth Fertility Research Center, Chennai. Prashanth Fertility Research Center was started in the year 2001, and since then we have had extremely good results. I have been in the field of infertility for the past 40 years. I've trained in the United Kingdom, and after coming back to India, I have set up Prashanth Fertility Research Center as a center at par with the Western world, and every year we keep updating our technology, and this has helped us to achieve great success rates, and we have an international accreditation, and one of the few centers with international accreditation, and we cater to a lot of patients from all over the world. You name the country and they come from all over the world, and many of them have had failed attempts in their country, and they come here and go home successful in the very first attempt of their treatment, and 70% of them go home with twins. Now, this is possible because of the high technology that we have, and selection of sperm is done by looking at sperm with 7,000 magnification, and this is a technology called IMSI. And once a baby is created, it's put in an incubator called the Embryoscope, which is the world's highest incubator, designed like the human body. You can see the embryo grows in very natural conditions because the oxygen, carbon dioxide, nitrogen, everything is like the human body. So the embryo grows in natural conditions, and therefore the quality is much better. Also, there is an inbuilt camera, so the camera keeps on taking pictures of images automatically every 20 minutes, and software analyzes these images and it selects the best embryos for transfer. So once the baby is ready for transfer, we look at the shell of the embryo, and if it is very thick, then the baby takes a long time to come out, and if it comes out late, it's already old, success rates drop. So we use the laser to thin it down so that it comes out on time, and to help it to stick to the lining of the uterus, we coat it with embryo glue. The glue helps it to stick on, and implantation rates increase from a normal of 60 to 65, which is there with the normal technology, to 80% with the high novel technologies that we practice. So all these years, Bangladesh patients have been coming to visit our center, but they did their tests here. It took a long time for them, and there are a lot of hardships which they faced. So now we have created a new system. We have selected and created a new center in Bangladesh, and this center, there is a doctor who reviews all your reports, reviews your case files, and she presents the case to me on screen, and we can discuss it with each other, and she will carry out all the instructions given by me. So you can make the diagnosis in Bangladesh, you can make the treatment plan in Bangladesh, you can start the treatment there, and you can come here and do the most important parts of the treatment here. So this cuts down your stay, and this brings down your costs too. And once you go back, this center is there to direct you to the best doctors there. We can also send you back to the doctors who you are normally used to. So the entire chain is taken care of. The most important thing that I identified in patients from Bangladesh is they come, when the women come, when the age is quite high, and so then the quantity of eggs is much lesser. So we have novel technologies for this, like we do a PRP technique. We have all the best drugs to make you get better eggs, and also we practice yoga and acupuncture, and all these really help you to get good eggs. The second problem identified is in the men: a low count, a low movement of sperm, and lots of DNA fragmentation, which is one of the current tests that we do. And anybody with more than 25% fragmentation, their IVF results are very bad. So we have treatment to correct these problems, and these are the two main things which I have identified in Bangladesh. Also, there are lots of patients with endometriosis and fibroids who come from Bangladesh, and for all these, there are good medical treatments and surgical treatments available. So we treat them initially, and with this treatment, a lot of people have gone back and had babies without IVF, because if you treat the primary cause, then your pregnancies can come even without IVF. So you don't need IVF all the time. You need treatment of your problem, and many of these problems we treat it effectively, and most patients go back and then they give me a phone call and a lovely message that they are pregnant. There are 2 information centers, one in Dhaka and one in Chittagong, and you can go to the center which is closest to you, and you can even book online appointments and talk to us. We have Bengali interpreters because we know that one of the major problems is the language as well as the food and accommodation, and we have made sure that everything is done very, very carefully and with great thought so that you get the food that you want, your travel is made easy, and your airport pickup drop is taken care of, your accommodation is taken care of, and overall there is an interpreter who will take care of you during your stay here. The husbands can stay just for about 10 days, but the wives can stay on till the treatment is over. And those who wish to go back early, all you need is 2 months. But for those who can stay here, who have complicated earlier pregnancies or lots of complications, they can stay on here for a longer time. And a lot of people would also like to deliver here, so we take care of them during the pregnancy, and particularly those with premature babies and twins. We have a tertiary care neonatal unit which takes care of all these babies, and there are so many people who have come from, thousands of people who have come from Bangladesh who have gone back with very good memories and 1 or 2 babies, and they have recommended us to a lot of their friends and relatives, and they have all come here and gone back with an equally good results. So thank you very much, and if any help that you want, please approach the centers in Dhaka and Chittagong.
মা, এই শব্দটা যখনই শুনি মনে হয় যেন আমার জীবন সম্পূর্ণ। হ্যাপি বার্থডে মা। আপনার মাতৃত্বের স্বপ্ন পূরণের পরিপূর্ণ সমাধান। প্রশান্ত ফার্টিলিটি রিসার্চ সেন্টার, চেন্নাই।